Please share these videos to all your friends and relatives, whether or not you have nursing students in your families, whether or not you know anyone in nursing school. Please share this video. We are talking about ethics and values. Non-maleficence is the ethical practice to reassure the public that the healthcare team works not only to heal patients, but agrees to do this in the least painful and harmful way possible. Beneficence is professionals have a moral duty to do right. Fidelity is faithfulness to a person. Talking about legal implications in nursing practice. A legal source of standard of care a nurse uses to deliver safe health care is policy and procedure. This is usually located in your nursing stations in the hospitals. State Nurse Practice Act regulations identified in the Joint Commission Manual. The American Nursing Association Standard of Nursing Practice. A surgeon is responsible for informing the patient about surgery, along with possible risks, complications, and benefits, not the registered nurse. If your patient is a Jehovah's Witness, has a life-threatening injury, including hemorrhage, may become anemic, if the patient is not able to communicate his or her wishes, please request a power medical of attorney. Medical power of attorney. Posting medical information about your patients on message boards, example, whiteboards, in patients' rooms is a violation of HIPAA, Health Insurance Portability and Accountability Act. Examples of breach of duty is failure to document a change of patient's condition in your assessment data, failure to notify your healthcare provider about changes in your patient's condition is a breach of duty. If a patient enters the emergency department, the ER, the ED, your patients may be homeless, poor, unemployed, seeking emergency care. The healthcare provider indicates that the patient should be transferred to another city hospital for care. This action is a violation of Emergency Medical Treatment and Active Labor Act. When a family member asks to see patient's medical records, determine from the medical record if the family is granted permission by the patient to access his or her medical information. When a family member asks to see the patient's medical record, determine from the medical record if the family has been granted permission by the patient to access his or her medical information. Nurse noticed significant bruising on a child's head, arms, abdomen, leg. Frequent falls reported by the patient's parent or family. The best action is contact Child Abuse Hotline. You are floated to another unit to assist them because they're short. If you're given an assignment that is beyond your capability, call the nursing supervisor to discuss the situation, please. Talking about communication, when working with older adults who is hearing impaired, techniques to improve communications are: check for hearing aids. Adjust the volumes on telephones. Give the patients time to respond to questions. Keep communication short and to the point. Nurses must communicate effectively with healthcare team. This reduces risk of errors to the patient. This provides optimal level of care of your patient. This improves patient's outcome. Nurses should include therapeutic communications while performing care to their patients. Use a professional interpreter to provide educations for your patient. SBAR, SBAR abbreviation stands for Situation Background Assessment Recommendation. This is a healthcare tool for communication. A new nurse experiences lateral violence in the workplace. To address this problem, talk to your preceptor or manager and ask for assistance in handling issue. Gathering physical assessment data. Please, listening to patients' concerns. Set goals of care that incorporates the patient's desire to make treatment decisions. This is an example of working phase. Assessing patient on admission. Use open-ended communication. Example: tell me what brought you here today. Tell me more. Tell me what's going on. To facilitate a safe transition of caring during a patient's transfer from the hospital to a nursing facility, example, to a nursing home, requirements are collaboration between staff members from sending facility to receiving facility. This is usually done by a telephone call. Transferring patients. Use your standardized transfer policy in your hospitals. Use your transfer tools in your hospital. A nurse uses silence as therapeutic communication techniques. The purpose of silence is to prompt the patient to talk when her or she is ready. In nursing education, a patient needs to learn to use maybe a walker. This is an example of psychomotor domain. Is required for learning this skill. The nurse is planning to teach a patient importance of exercise. The best time for teaching is when the patient states he or she is ready. When the patient states he or she is free of pain. When the patient is most alert and awake. Teach-back method is a closed-loop communication technique used to evaluate patients' understanding and retention of material. When planning diet instruction for your patients, instructional methods most appropriate to someone identified as a visual spatial learner would be, example, colored visual diagrams that categorize foods. For cultural group, the nurse is organizing a disease prevention for a cultural group to effectively meet the needs of this group. The nurse will 1. Involve those affected by the problem in the planning process. 2. Assess commonly held health belief among this cultural group. 3. Include cultural practices that are relevant to this specific community. When teaching the elderly, allow patient time to express him or herself and ask questions. Patients expressing the importance of learning a skill correctly reflects that the patient is ready to learn. Patient is going to need to learn how to give himself injection. The teaching method the nurse uses is demonstration. Teaching a group of young adults the importance of sun screening when going out in the sun, the nurse is providing health promotion and health prevention. For documentation, enter only objective and factual information on medical record about patient. All medications before you given to a patient must be reviewed by a pharmacist. Entered on a medical record of that patient before administration. HIPAA, Health Insurance Portability Accountability Act, provides patients with greater protection of personal information. Patients requesting to see what is written in their medical record have a right to read their medical record. Examples of most accurate entry is, example, patient walked 60 feet and back down the hallway with standby assistance from nurse. Heart rate 60 and regular before exercise. Heart rate 75 and regular following exercise. For documentation, we're talking about our SOAP. S stands for subjective. O stands for objective. A stands for assessment. P stands for planning. Example of S, which is subjective. My pain increases when I lie on my left side. O, objective. Example, left lower quadrant surgical incision is 3 inches in length, dressing clean, dry, and intact. A is for assessment. Example, pain scale assessment 3 out of 10 related to surgical incision. P is for planning. Example, repositioning patient on right side. The electronic health record allows the nurse to review education that other providers provided during initial hospitalization. RNs are able to view prior hospital visits in the electronic medical record. When transferring patients from one hospital, maybe to the nursing home, long-term skilled care facility, both nurses from each facility gives a telephone report on your transferring patient. Our telephone conversation will be example of this transferring patient to the facility. You will discuss in your report the name of the patient, the age of the patient, male, female, admitting diagnosis of your patient to the hospital. Discussion of allergies, food, medication. The patient's pain rating, pain scale 1 out of 10. The pre-assessment pain scale before administration of pain medicine, then the post pain scale assessment after receiving pain medication. In your telephone report to the nursing facility, you will discuss in your telephone conversation description of any unresolved problem and current intervention in place. Nursing students' documentations are under direct observation of a registered nurse. In a nursing student's documentation, you will include in the medical record the date and time of entry. You will document assessments into your electronic medical record using computer mounted on wall in your patient's rooms. A narrative comment in your nursing notes should be documented on your patients. Example of your nursing notes documentation will be Colis 100 milligrams PO by mouth ordered at 0800 held. Patient declined to take stated medications. Stated, I have several loose stools yesterday. I am afraid to take any today. Open and close quotation. This is subjective to the patient. MD notified. Major advantage of CPOE, computer provider order entry. This entry reduces transcription errors. For documentation exams, please go over your military time. Example 8 a.m. is 0800. 8 p.m. is 2000. 2000. Definitions of clinical decision support systems. This is computerized systems in the computers that are used within the healthcare settings to support decision making. For example, if you document that your patient is receiving tube feeding at 45 cc's an hour, if the nurse enters the patient's assessment data, information is 20